The three techniques we will be talking about in this video are mobilizing, weight bearing, and guiding.
Next, I'm going to talk about mobilizing with my client. This is a preparatory activity before you do an intervention with a client to make sure they are in proper alignment before you begin. You want them to be in proper alignment so they don't have those irregular movement patterns all the way through the intervention. You want to make sure they have the regular movement pattern down before you continue on to the intervention. So what I'm going to do is I'm going to place one of my hands, and I get kind of close to you. I'm going to put one of my hands on her lower back, straight up and down on the lower back, or you can do it upside down, whichever more comfortable. So I'll do mine upside down, pushing her lower back, and the front of your hand is going to be pushing against their chest. So just do a light push in the lower back and onto their chest just to get them in that proper straight alignment. 1, 2, 3. And you can see how the client goes from a, can you slouch a little bit more now? Comes from a normal resting slouching position to an upright straight alignment position. So you can do this a couple times until the client gets a feel for what position they should be in, and then you can proceed to your next steps in your intervention. My client had a CVA and has left extremity weakness. I'm going to be walking her through an NDT technique called weight bearing, and we are going to be focusing on grading movement patterns. So what I'm going to have the client do is she's going to be reaching overhead in the cabinet above her. I'm going to be having her use the weight bearing technique by placing her left hand on the countertop and using that to push and help stabilize her to reach up above the cabinet. By using the weight bearing technique, it can reduce spasticity in a client. It can also increase stability and helps with fall prevention. So this is good for clients that are early in stages of their treatment, just because it helps with their balance and stability as they are participating in occupations. So I'll have my client begin. You can go ahead and push with your left hand and reach overhead to open the cabinet and grab a cup or anything that you need by pushing down and close the cabinet. Great. Next, we are going to be demonstrating the guiding technique for NDT treatment. What my client is going to do is she is going to use her unaffected side, which is going to be her right side, as I said before, to use for her affected side, her left side, to grab a cup of water and drink. So my client will go ahead and use your right arm and grab around your wrist area and go ahead and bring your arm to the cup, grasp the cup, and bring the cup to your mouth and take a sip. You notice she is using her unaffected side to guide her affected side to take a drink of water.
Next, I'll be showing bed mobility using NDT techniques. In this demonstration, you will see me using the proximal points of control and weight bearing through bed mobility.
Next, we're going to be talking about bed mobility using the NDT treatment approach. What I'm going to be doing is using the proximal points of control and rotating her from a supine position to a side lying position to a seated upright position, and I'll talk about how I'm going to include some weight bearing on the affected side. So I'm going to be rolling my client from her onto her affected side, which is going to be her right side. So we're going to be rolling her towards the camera so you'll be able to see where I'm at. I'll explain the steps as I'm going through. Hello, my name is Andrew. I'm going to be your occupational therapist today. We're going to be working on bed mobility. Okay. So first I'm going to have you push your arm up over your head, and you're going to reach across your body and grab onto the side of the bed. And I'm going to bend your left leg up. I'm going to be holding on to shoulders and hips, and we're going to rotate on 3. 1, 2, 3, and roll. So next I'm going to have my client do is she's going to assist me in moving her up into a seated position, but we're only going to come up about halfway. I'm going to have her rest on her elbow to get some weight bearing onto her affected side. Okay, are you ready? So I'm going to place my arm underneath her on her shoulder and keep one arm on her pelvis. Okay, ready? I'm going to push up, and I'm going to have her stay there just for a few moments to get that weight bearing on her affected side. And next I'm going to scoop underneath you and grab at your legs, and we're going to sit all the way up. 1, 2, 3. Great, thank you.